I'm Dr. Narda Robinson. I'm an osteopathic physician and veterinarian, and I'm a fellow of the American Academy of Medical Acupuncture, of which I'm also a member. I want to talk to you today about tinnitus. It's a condition where people might hear just a constant ringing. And this isn't from an external sound, and we usually say it's not from any kind of vascular rushing of blood in the vessels. It's not from auditory hallucinations, but it's really an ill-defined source of just a chronic ringing in the ears. And in modern industrial countries, it's prevalent in about 18% of people with some kind of chronic, low-lying, constant kind of ringing. So it's really important to determine the source of this tinnitus or ringing, if possible. And that will help you get a better outcome from acupuncture. So where I find it most effective is when people have neck tension or some kind of facial tension, some kind of temporomandibular joint dysfunction, especially if they're chronically clenching the jaw. I find that if the source of that is from this kind of head and neck region, that gives me the best outcomes where I can identify where those restrictions are and how they are contributing to some kind of imbalance in that temporal region near the ear that is accentuating this ringing process. Or if I can talk to people and find out that they are on too much aspirin or other medications or caffeine that's causing that tinnitus, then we can weed away those inciting causes so that we get the best outcomes. Because tinnitus, as opposed to other kinds of pain or inflammation or maybe depressive problems, has been fairly resistant in the past to acupuncture according to research. So the better, again, that we can define the source, the better we can narrow in and then treat it. In traditional Chinese medicine, you might hear people say that for ongoing tinnitus or this ringing, that it's a kind of chronic kidney deficiency, and they're talking about energy or realms of the body. For the ringing that you might hear that might be a higher pitch, if you get really stressed or upset, and that's more transient, then they might say that's a liver excess or a liver yang rising. But personally, as an osteopathic physician and a neuroanatomic acupuncturist, I really try to identify if that person is suffering from this condition, from something in the musculoskeletal system, and then I can treat that very specifically and get much better results than a more indirect method. And the other thing is that even conventional measures don't really have much value. So the people that I've seen that come to me for the treatment of tinnitus have usually been told by their ear, nose, and throat doctor or whoever they're seeing that there's nothing that can be done with it. So they have to take measures to get them to adapt to it. It's going to be throughout their life. And that can be extremely stressful for people. It can make them depressed and really generate a lot of anxiety that this constant noise will never go away. And so by being able to change it in some way and identify contributing factors, it's really an important boost for people. And then when we get some effects because of diagnosing it really precisely, then they're so much happier because they didn't have a lifelong sentence of constant noise. So it's really oftentimes worth a try. Acupuncture is overall very safe, and really have somebody feel about where the contributing sources are to that dysfunction.